Hello everyone, today we are going to learn about this squamous papilloma. So as the name is indicating, what does this squamous means? This is indicating is that here the squamous epithelium will going to be involved. What is papilloma? Papilloma is nothing but proliferation of the tissues. So here the squamous epithelial proliferation of the tissues will going to be seen. So now let us see what it is. So it is a benign proliferation of stratified squamous epithelium. It produces a papillary or the verruciform masses. So verruciform or the papillary masses is nothing but like this. These all projection like masses is seen. It is the fourth most common oral mucosal mass. Here the involved virus is usually HPV 6 and 11, human papilloma virus 6 and 11. Here the infectivity rate will be low and low virulence rate is also seen. Now let us see clinical features of it. So here it will going to be occur equally in male and female. Common age is 30 to 50 years of age. Intraoral sites are usually tongue, lip, buccal mucosa, soft palate and gingiva. So clinically it appears as soft, painless, pedunculated, exophytic nodule with numerous finger-like projection on its surface. So it will somewhat look like this. Finger-like projection will going to be seen on surface. So because of this pedunculated and numerous finger-like projection on its surface, it will going to give a verruciform or a cauliflower-like growth appearance to the lesion. So the growth is usually white, red or normal color. So this color is going to be depends upon the amount of keratin present. So if the large amount of keratin is present, it will be going to be white in color. If less, then it will be red in color. So it depends upon amount of keratin present in it. So these squamous papillomas are usually solitary and enlarged to a maximum size of about 0.5 centimeter. So multiple oral papilloma will going to be associated with syndrome called as Cowan Syndrome. So this is again a MCQ question where multiple oral papilloma is seen. So it is seen in Cowan Syndrome. So now let us see histopathological features of this squamous papilloma. So here proliferation of keratinized stratified squamous epithelium in the form of round finger-like projection will going to be seen. Each epithelial projection has a central core of fibrovascular connective tissue. Features of mild atypia like basilar hyperplasia will going to be seen as well. And also one of the most important feature is the presence of coilocyte. This is a special cells. So these coilocyte is nothing but HPV altered epithelial cells with perinuclear clear spaces and nuclear pycnosis. So this is again an MCQ question where the coilocytes are seen. So it is seen in squamous papilloma and it can also be asked in viva what is coilocytes. So you have to remember this definition as well. So now let's see the histopathological features here with the help of this diagram. So as you can see in this picture, there is outermost keratinized layer is seen, that is keratinized stratified squamous epithelium. All this central area which is present, these are nothing but the central core of the connective tissues seen in between those finger-like projection. So as you can appreciate, these all are the finger-like projections of the epithelial masses. And as you can see here, the hyperchromatism of cells is seen in between, like you can see here, here and here. So these are nothing but cellular atypia, that is mitotic figures can be seen, and all these cells which is present into the epithelium are nothing but these coilocytes, that is HPV altered epithelial cells. Now let us see in this histological microscopic picture as well. So you can here also see all these are the finger-like projection of epithelium, and in between there is all connective tissue core can also be appreciated. Now let us see what will going to be treatment for this squamous papilloma. So excision is the best choice. So what we will do, excision including the base of the mucosa into which the pedicle or stalks are inserts. Apart from excision, we can also do liquid nitrogen cryotherapy. Topical application of keratinolytic agents can also be used as the keratin production is seen. So we can use keratinolytic agent, that is keratin destroying agent. Recurrence is usually very rare. No report of malignant transformation has been seen. So these are the different treatments we can do in case of squamous papilloma.